That was our first video from Khan Academy. The second video is going to cover the systemic and the pulmonary circuit. I'll just briefly introduce those. Systemic circuit is what transports blood from the heart to the system. We're looking at the red arrows. They're coming from the left ventricle. This is oxygenated blood that's leaving the left ventricle, moving through the semilunar valve and splitting off and going to the upper and lower parts of the body. It goes from the artery. This aorta is a major artery, branches off into tinier and tinier diameter vessels, ultimately getting to capillary beds in the upper and lower parts of the body. This is where the oxygen will diffuse out of the blood and into the surrounding tissues and into the organs. Oxygen moves out of the bloodstream into the tissues, and CO2, or carbon dioxide, then moves from the tissues back into the bloodstream. We now have deoxygenated blood, which is on the left part of this diagram. It's what's on the left side, the deoxygenated blood, that then starts making its way back to the heart through the veins. Arteries move away from the heart, veins move back to the heart. So these veins carrying deoxygenated blood move through the blood vessels, merging into larger and larger diameter blood vessels until you have the inferior vena cava with deoxygenated blood entering the right atrium and deoxygenated blood moving through the superior vena cava from the upper parts of the body entering the right atrium. And that's the systemic circuit. The pulmonary circuit refers to the blood that's moving to the lungs. We would have deoxygenated blood moving to the lungs because that's where it picks up oxygen. The pulmonary circuit starts in the right atrium with blood that's coming from the system or the systemic circuit. It enters the right atrium, crosses over the right AV valve into the right ventricle, then through the semilunar valve, moves up, splits into the left and right pulmonary arteries, breaking into smaller and smaller blood vessels until ultimately these tiniest diameter blood vessels called capillaries enter the lungs. It's at the level of the capillaries in the lungs that the CO2, that's what makes the blood deoxygenated blood, diffuses out of the bloodstream into the alveoli, which we'll look at in a second. You exhale that CO2, the oxygen that you inhale moves from the lungs back into the bloodstream and oxygenates the blood, which then starts moving back towards the heart, entering the left atrium. That ends the pulmonary circuit. Pulmonary circuit involves blood going to the lungs. The systemic circuit involves blood going to the system, to the rest of the body. Now watch the Khan Academy video on 2 circulations in the body. A little more information on pulmonary circuit. We've seen this diagram before. These are alveoli. They're tiny grape-like sacs at the end of the bronchioles in the lungs. On the left, we have one that's been kind of cut in half, so you can see that's a clean one. That person's not smoking. The one on the right section where the blood meets up with the lungs. These are capillary blood vessels. These are tiny, tiny diameter blood vessels. The blue ones represent deoxygenated blood, in which the CO2 will diffuse from the capillaries into those grape-like sacs known as alveoli, and then you will exhale that CO2. The red capillaries represent oxygenated blood. As you inhale through those alveoli, the oxygen diffuses across the membrane into the capillaries, thereby oxygenating the blood, and the oxygenated blood will move throughout the rest of the body. That's the circulatory system. It's a system or network of blood vessels that carries blood throughout the body. Pulmonary circuit, arteries carry deoxygenated blood away from the heart. Veins carry oxygenated blood back to the heart. In the systemic circuit, the superior and inferior vena cava carry deoxygenated blood to the heart. The aorta, the huge artery that leaves the heart, carries oxygenated blood to the body. If you want to look at a rap song, who knew that you could put the pulmonary and systemic circuit into a wrap, you can look at this link that I have posted online. Heart attacks are the #1 cause of death in the United States. Although tobacco is the #1 preventable risk factor for premature death, don't smoke, you'll die. The death rates may be dropping for people who have support and health care. People may be living longer with heart disease and not dying from it. Your heart is a double pump. It consists of the heart, the circulatory system, and the blood. All of this meets at this organ that's maybe the size of a clenched fist. Your heart pumps about 5 quarts of blood every minute. Through the middle of the heart, we have tissue that's called the septum. It divides the heart into 2 halves. The chambers in the upper part of the heart are referred to as the atria, or the right atrium and the left atrium. The lower chambers of the heart are referred to as the ventricles. And we have valves that separate the chambers. The valves that lead from the atria to the ventricle are called the AV valves. And then the valves that take the heart from the ventricles to the rest of the body are called the semilunar valves. I don't know if you can hear my neighbor's truck backing down his driveway, but I'll just carry on. Capillaries are blood vessels that are specially designed for diffusion. They are tiny, tiny diameter blood vessels that basically connect arteries to veins, or in this case, the tiny diameter artery called the arteriole and the tiny diameter vein called the venule. The capillaries, in this case, we're looking at blood flowing away from the heart, oxygenated blood, going to, let's say, your left toe. So the blood that's flowing from the heart, oxygenated blood, is going to move into these smaller and smaller diameter vessels until it gets to your toe. And then it'll move through these capillaries with the oxygen diffusing out into the surrounding tissue. CO2 will then move into the capillary as deoxygenated blood, and the vein, the small diameter blood vessel called a venule, will then move the deoxygenated blood back to the heart. Coronary arteries are specially designed to transport oxygen and to and from the heart muscle itself. This 1-minute, 7-second video will review that with you. Please feel free to look at it. Don't worry about all the different names on either side of the heart. I've talked about what I want you to know, but from this slide, what I want you to understand is that the heart operates separately in terms of how it receives its oxygen and it gives up its CO2. What you see cushioning kind of the coronary blood vessels is fat tissue, but this isn't the type of fat tissue or fat that causes heart disease. It's the fat that's found inside these blood vessels, not surrounding the blood vessels, but inside the blood vessels, that ultimately clog the heart and ultimately clog the blood vessels and can lead to heart attack. The heart generates its own impulse. The heart will beat independent of what's going on in the rest of the body. And that's because of this sinus node, or SA node. There are cells in the right atrium that produce an electrical signal that spreads across the heart in waves. This electrical signal from the SA node moves to what's called the AV node, and then that spreads throughout the entire heart. What's unique about heart muscle tissue or cardiac muscle is that it contracts and relaxes as though it was one single tissue or one single cell. When you contract, say, your arm, different skeletal muscle tissue contracts at different time as you move your arm up and down. But your heart muscle, they all move at the same time. That's what's incredible about the heart muscle. One of the things you'll see in the video about the gentleman having the heart attack is that there will be a time when he appears to have survived his heart attack. Spoiler alert, the guy has a heart attack. But what happens is that for some reason, one of the cells in his heart decides to starts beating separately from the other cells in the heart. The narrator refers to this as electrical anarchy, because all of your cells in your heart, all of the tissues in the heart are supposed to relax and contract at the same time. This link will take you to a video that shows how a pacemaker works. A pacemaker replaces somebody whose SA node isn't working. The pacemaker will set the pace by which the heart is supposed to contract and relax.